All right, everybody, how are you doing? I'm yours truly, Dr. Lastimado. We are here again at Reliable Dental Lab Surgical and Education Training Center. Definitely very honored to come to you this morning. Happy Tuesday, everybody, for another VERL. Yes, as you know, a VERL is a video pearl, and we're doing a nice advanced anterior surgical procedure this morning. And so I just wanted to shoot a little VERL with you of how, when we're going to go ahead and, as you'll see here, we have our very kind mystery patient this morning. We have essentially a tooth number 9. Number 9, unfortunately, has a 15 millimeter perioprobe depth, and there's some bone loss here right on the distal buccal area, as you can see. And so as we come in here, when we feel, you can see there's a mesiobuccal root fracture, okay, right on the mesiobuccal line angle. So, but before we go ahead and proceed to extract a tooth and do an immediate anterior implant, hyacinth implant, and graft and things of that nature, we need a reference point for that depth placement. So you can see this, the number 8 has a nice height here. We have good thick gingival biotype, so we have a little bit of room to play with, a little bit, not too much. And so what we want to do is take a preliminary impression and fabricate what's called a so we're going to take a pre-surgical impression and fabricate an open guide. The open guide is going to give us a visual reference of how deep do we place the implant, and also for angulation, so that if we decide to do a screw retain final restoration, the screw access hole is not going to be coming out the facial. Okay, so all we do here, I have my great chairside assistant here, Alicia from Hyacinth. Thank you, Hyacinth. And we're going to just really use, we have our Optrogate, as you can see, we have our Optrogate in place, and I'm just using some PVS impression material. Yep, go ahead and fill, and I'm just going to capture the line angles, and we'll show this step by step. We're just going to take a preliminary impression, not anything too fancy, of this area, and then what we're going to do is go ahead and on the cast remove the tooth, either throw in a denture tooth or wax up an ideal tooth of number 9. And then, as you'll see, we'll fabricate the surgical open guide real quick. Real straightforward process to do this. And it gives you a reference, because if we have no reference, then we're basically sort of guessing of how deep does that anterior implant go. So, okay, thank you very much, appreciate it. And we're going to take this impression here, just like so, okay? And we're going to let that sit. And we'll see, as we set this impression, you'll see the process step by step, how we go ahead. All right, everybody, how are you doing? I'm yours truly, Dr. Lastimado, here again on a part 2 section here at Reliable Dental Lab. As you saw, we're about ready to get to do live surgery so that we can shoot this VERL just for you guys at home, so thank you for watching. And so this is the second part. So as you saw, we took an impression of our patient. You had seen we're going to be taking out number 9. And what I'm doing is just a real quick, real fast in-office chairside open guide. So we have our impression all poured up, and so we have our initial stone model. And what we're going to do is essentially we knock off the cast. If you can see here, right here along the gingival, this is basically number 8, and this is number 9. But this is the gingival zenith of number 8. So we have to ask ourselves surgically, how far is the implant going to go at this level, right? So we have to determine this distance. Well, we know that right now the gingival zenith is here, so we have to try to replicate this, and that's where your open guide comes in. So I'm going to go ahead and cut this down on another model, and then wax in magically, get ready, just a quick denture tooth, okay? So I cut the tooth off, and I went ahead and marked my gingival zenith here, as you can see, so that in general it lines up with the adjacent tooth next to it, okay? Of course, we're going to come back once everything's healed and everything's integrated. We're going to go ahead and do a screw retain provisional, which you guys will see later on of how we make that, and then we're going to come back and do some laser therapy to recontour the tissue and do some nice veneers all the way across. But here today we have to determine how far, again, below the gingival zenith of our final restoration, or the CEJ of our final restoration, where the implant's going to reside. And the key answer to that is 4 millimeters. So what we're going to do now is go ahead and put this in the machine here at Reliable Dental Lab and do a quick S6 retainer off of this. And as you'll see in live surgery, I'm going to use that S6 retainer to determine how deep that implant's gonna go, okay? So this is basically the second part of the process to make a quick chairside open guide, and check us out later. Boom. Boom. All right, everybody, how you doing? I'm yours truly, Dr. Lastimado. We are back again with this Viral today for how to fabricate a quick chairside open surgical guide. So as you saw earlier in the video, we went ahead and took an impression. We went ahead and poured it up. We actually went and, as I'll share with you here, we went ahead and knocked the tooth off, as you can see, just like that, okay? And we went ahead now and then took all that to surgery, as you'll be able to see here. And as you can see, we went ahead and atraumatically extracted the tooth. Very nice. We kept the papilla intact and went ahead and curettage and irrigated and cleaned everything out. We went ahead and already created our osteotomy. So if you want to go ahead and see, we went ahead and created our osteotomy already, straight down the center. And what we're doing here now is we're about to go ahead and place our Hyacin NH implant. And this is our nice open guide. And what it is really just a visual reference. And here's the cool thing. As we're drilling, you can see, I'm just going to place our 3.5 Hyacin drill. We are going to place a 4.0 NH implant, okay? And what we want to do, the whole idea is to not follow the teeth, but transport the implant preparation site slightly palatally, okay? So that if we decide to do screw retain, the screw access hole is not coming out the facial or the incisal edge. So this allows us, as you can see, we'll come here to verify as we were drilling, and this snaps right in. This is a proposal of the final restoration. This is where the screw access hole will be coming out, because now what's coming up next is that's where our implant's gonna go in. So this is a really nice, quick chairside technique. Of course, you can have the lab prefabricate this before surgery, but this is a really nice, very inexpensive, but very effective technique to create a clear open guide, as I showed you, step by step by step, here in this video Viral with yours truly, Dr. Lastimado, so that when you're drilling and putting your osteotomy and ultimately placing our implant, we want everything in the right buccal palatal position. So hopefully you find this very valuable to your practice. I'm yours truly, Dr. Lastimado. I want to give a quick shout out to Reliable Dental Lab and to my awesome assistants today, Alicia from Hyacin Implant, thank you so much, and Trinity, who's behind the scenes. But visit us at www.rdldental.com, or you can visit yours truly, Dr. Lastimado, at www.dentalcetrain.com. So stay tuned, check us out, and we'll see you later. Boom.